Nowadays, there are more choices than ever in vitamin supplements. So, we're discussing vitamins for health. Our guest, Deb Hollingstadt. She's a nurse practitioner with Cumberland Healthcare. This is Healthier You, a podcast from Cumberland Healthcare. Thanks for listening. I'm Joey Waller. Hi, Deb. Thanks for joining us.
Hello. How are you?
I'm good. Yourself?
Pretty good.
Did you take your vitamins today? I have to ask.
Take my vitamins every day. I never do anything I ask of my patients. I do it myself also.
That's a great rule of thumb to get us started. So first, are vitamins really necessary for everyone, Deb? Should everyone be taking some form of them?
Vitamins are supplements that are used, and there is a recommended daily allowance. If you eat a well-balanced diet and get all of the nutrients in your food, then you really don't have to take a supplemental vitamins. But if you don't get a well-balanced diet or you're going through a time of stress in your body, then adding vitamin supplements to your regimen will help you either heal faster, feel better, you have a healthier lifestyle.
Gotcha. So hence the word supplement, right? They're meant to take the place of something that you're not getting otherwise.
Correct.
So that being said, I guess a regular checkup and blood work along with it can tell us which vitamins we're deficient in, right?
It can, especially the vitamins and the minerals. The minerals are potassium and magnesium, phosphorus, calcium, whatever. If you do lab work with your physician, they can tell you if you are low on them. We live in the northern climate of Wisconsin, so we don't have a great amount of sunshine a lot. So we do not get enough vitamin D3 via the sun as we really need. So taking a supplement of vitamin D3 will help you with that.
Ah, interesting. So the vitamins you need could be at least in part dependent on where you live.
Correct.
So which vitamins do people usually need the most?
You look at what you really need. The areas that I work at in the hospital and clinic, I work with oncology or cancer patients and wound patients. So I tend to look at the vitamins that will help them either recover faster from a chemotherapy treatment or recover faster from a wound that isn't healing to help it heal faster. So the vitamins that I really push are vitamin D3, vitamin C, zinc, magnesium, and the B complex vitamins.
So that's interesting too, that when you work with those patients, whether it be recovering from a wound or a chemotherapy treatment, their bodies obviously are in an altered state, if you will, when it comes to vitamin deficiency, right?
Correct. It's not only vitamin deficiency, but if you're not in optimal health, your body is actually stressed. And that increased stress, some patients will feel it by an upset stomach. So when you're under stress, your stomach produces more gastric acid. Things go through your body faster and they don't have time to absorb. So adding a supplemental vitamin or mineral to your regular diet will help you achieve optimal health faster.
So when you say that, what about quote unquote regular stress in our everyday lives? Might that bring on the need for more of a certain supplement?
Absolutely. That's why a great percentage of the population takes that little purple pill called Prilosec.
Okay. And tell us, for those that don't know, what that is.
Prilosec is omeprazole. It is for gastric acid, gastric reflux. So if you have any heartburn or any gastric reflux, then your doctor will tell you to either take Prilosec or omeprazole or Tagamet. There's a couple other different drugs. But because of that, your gastric acid is burning through your nutrients faster. And so you may need to supplement even if you're taking a healthy diet.
Gotcha. Now, you mentioned a moment ago a few basic vitamins that many people commonly take. Can you just quickly, please, go through a few of those and tell us what they're for? How do they benefit us?
Starting with vitamin A is found in vegetables, eggs, milk, and fruits. It's for your skin, bone health. It fights infection. It helps with your vision and your heart, lung, and kidney function. Vitamin A will be found in a lot of like Preservating for eye health that you see on the TV that has a high component of vitamin A in it. Vitamin B complex, I put a lot of my cancer patients on a vitamin B complex. It's a stress vitamin. So if you're under stress, you'll burn through this faster. So you want to supplement with that. It also helps with neuropathy, peripheral neuropathy, either from chemotherapies or from diabetics. They lose the feeling in the tips of their fingers and the tips of their toes. And that actually helps build those neurons back to keep that feeling there. And that's usually found in breads and cereals and pasta. But it's really good for brain metabolism. It helps to decrease your LDL, which is your bad lipid profile test. Also decreases heart disease and helps your cells rebuild and function better. Vitamin C, of course, protects cells, makes collagen, reduces the common cold, and takes skin, bone, and teeth. Women who reach the age of menopause, you don't produce enough estrogen, or you could be blocking your estrogen if you have breast cancer. So we ask you to take vitamin C along with calcium and vitamin D3 so that you get that bone health back. Otherwise, your bones become very, very brittle. Again, calcium, muscle, skin, and bones. So make sure you get enough calcium. I tell patients at least 1,200 milligrams of calcium a day. So that's 2 tablets. Vitamin D, you find that in fish liver oils, fortified milk and stuff. Take 2,000 units a day, and it has to be vitamin D3. It influences your immune system, so it actually helps to keep you healthy. Fights fatigue. You won't feel as tired if you take your vitamin D supplements, and it helps with bone health again. Vitamin E protects the cells, maintains your muscle mass. It is thought that it could increase your immune system to help fight cancer. So it decreases the incidence of cancer, helps in heart regulation, and it also decreases the effect of Alzheimer's. So that's a good vitamin to take. Vitamin K is found in green leafy vegetables, blueberries, figs, cheese, eggs, and some meats. That helps your blood to clot. It also helps in bone formulation and helps wounds heal. The rest of them are basically minerals. We use minerals and vitamins together because they kind of are like best friends on the playground. You hold your hand and you go along and you have a good time. So it's really important that you do that also.
Nice analogy. By the way, I didn't even know there was a vitamin K.
Oh, vitamin K. Some people will have trouble. We call them bleeders. I was a bleeder as a child. I would bleed spontaneously, and it was because my iron levels were low and my vitamin K levels were low. So I had to grow up eating a lot of chicken liver.
That must have been fun for you.
No, it was. I outgrew it, so it must have worked.
Excellent. So let me just follow up real quick on what you mentioned about the vitamin D3. I know people who swear by it, who say that by taking the right amount daily, they haven't been sick for years. No cold, no flu, no anything.
Correct. Again, it's used to help boost your immune system and make you feel good. Vitamin D3 was one of the supplements that was recommended during COVID to help boost that immune system and help you actually fight a virus on your own.
Right. Now, what about taking, Deb, a multivitamin in order to get all the things you mentioned, or most of them? And are all of them kind of the same or not?
Your body doesn't really know the difference between Walmart and Shaklee or whatever. So it really doesn't matter. You get it from a reputable source. So Nature Made is a good vitamin. Centrum is a good vitamin. The multivitamin is your basic recommended allowances. Some of those vitamins that I talked about, those are the ones that we would want you to take above and beyond, because you want to make sure that you get adequate amounts to make your health the best it can be.
Right. So you take the multi to get a little bit of everything, and then perhaps a supplement or two on top of that if you need those in particular, right?
Correct.
Okay. A couple of other things. We just touched on it with the vitamin D3. Part of what you're saying here is that vitamins can really literally help prevent illness, right?
Correct.
What other things besides just, say, the common cold or virus can they help ward off?
Cancer is caused from a cell disruption in your body. Something has affected the cells of wherever the cancer arises in your body. Your body was made to fight off anything that attacks it. So you should be able to maybe fight it as long as you can. But a lot of times cancer will reoccur because a patient gets run down or fatigued. Their health isn't optimal. And that allows the cancer to regrow, come back. So does it prevent cancer totally? Well, no, because we also immerse ourselves in things in our nature that can cause cancers.
So it sounds kind of like what you're saying to some extent is that vitamins serve almost as an oil would in your car, that we need it basically to help our bodies run as efficiently as they can, right?
Correct.
What's the best time of day to take vitamins? My mom would always say you got to take them in the morning and take them on a full stomach after breakfast. Is that true or no?
That is true. You shouldn't take them like if you're on thyroid medications. Make sure that you check up on your medications to see if you can take it with the vitamins. The ones that I tell people to take at night are zinc and magnesium. If you take those, they will actually help you sleep. You want to take the B vitamins, the super B complex in the morning, because if you take it at night, it might keep you up. That gives you energy. It makes you feel good. So take that in the morning. It's your feel good vitamin for the whole day.
Gotcha. And finally here, Deb, in summary, what would you say to those listening if they're thinking, I haven't been taking any vitamins, or perhaps I'm not taking all that I should, but I don't know what I need? Remind us again, please, what's the first step to find out?
Talking over with your physician to make sure that there's no drugs that you're taking, one of your medications or your health precludes you from taking vitamins. And then you might need to do a level. If your vitamin D level is very low, they may need to give you more than the supplemental dose. You may get a larger dose, say once a week. So that will be needed. Magnesium and potassium, you want to make sure that those levels are within your normals, because that's what makes your heart beat healthy. So they will tell you exactly if you need to take extra than just over-the-counter potassium. You might need to take some prescribed potassium with it. So check with your doctor first, and then if you need to call, and I can answer questions.
Excellent. So folks, we trust you're now more familiar with Vitamins for Health. Deb Hollingstadt, thanks so much again.
Thank you very much.
And for more information, please do visit cumberlandhealthcare.com/services/healing-center/ you just heard Deb mention. You can contact her direct. And if you found this podcast helpful, please share it on your social media. And thanks again for listening to Healthier You, a podcast from Cumberland Healthcare, hoping your health is good health. I'm Joey Wallach.